Right. So if you have read and understood, considering it procedural skill station, kindly begin.
Okay. I'll enter the station. I'll wash my hand. I'm going to introduce myself to the patient. Good morning. I'm Dr. Olu. Are they one of the surgical doctors? Can I please confirm your name and age, please?
I'm Timothy, 33 years old.
Okay. Nice to meet you, Timothy. And so today I've been asked to pass a rubber for you through your waterworks. This is because of the problem you are having with your passing urine.
Yes.
Yes, the waterworks. So this rubber has some risks that is associated with it. First, when I want to pass it, I'm going to give you a drug that is going to numb your waterworks and also make it easy for me to pass the rubber. And then the rubber has some complications that will occur. There can be infection, and it can be passed to a forced passage. Then also there can be bleeding from your ureter due to injury. Those are the problems that can occur with it. And then, is it okay by me? Do you agree that I should pass this catheter for you to relieve your
doctor.
distension?
If it
Okay.
has to be done, yes.
Okay. So I'm going to ask for an assistant and also do is also serve as the chaperone. So now, Timothy, I would like you to. Okay, I want to ask a question. Have you had this catheter pass before?
No.
Okay. Do you have any allergy?
No.
No. Okay. All right. Okay. So can you lie down? So I'll position him on the couch and then expose from the nipple line to the mid thigh. Then I'm going to gather the materials that I want to use: size 14 French catheter, the lidocaine, the surgical glove, and then also the urine bag or urometer. And then also, so now I'm going to go and scrub and then wear two surgical gloves and put on apron to pass it. So, Timothy, now I want to clean your penis. So I'm wearing two gloves. I'm going to hold the glands and then clean with povidone iodine from the glands of the penis down towards the shaft. And then after cleaning, I'm going to put an apron. Then I'm going to drop the penis and then I'm going to off my outer glove. Then I'm going to, so now, Timothy, I want to put the drug that I said that is going to numb the place and not make you have pain. So I'll hold the penis and then put the xylocaine gel inside. And then after putting the xylocaine gel, I'm going to hold the penis at the glands for 3 to 5 minutes. So I've put the gel there. I'm going to hold on to it for about 5 minutes for it to numb the place. Is that okay, Timothy?
Okay.
Yes. If you have any problem, do let me know.
Yes.
And then I'm going to tell you once I want to pass the catheter. Okay. So now my assistant is going to give me the catheter, the size 14. So I'm passing the catheter now. So you may feel like something passing through. So I'm going to pass the catheter. Then I get to the Y junction. Then after getting to the Y junction, I will ensure that urine is coming out. Then once urine is coming out, I'm going to inflate the catheter with 10 minutes of, I'll connect the urine back and then inflate the catheter with 10 minutes of urine. Then after that, I'm going to put the catheter slightly out. Then, so now, Timothy, I'm done with the passing the catheter. So I'm going to allow the urine to flow for the initial 5 to 10 minutes and then empty the urine bag. Then now, so I'm done, John. I'm going to discard my materials into the bin and then I will clean him up, remove the excess gel that is on him. So now, John, can I assist you to dress up? Do you need any assistance to dress up?
No, that's okay.
Okay, so I'm done. So this I've passed catheter for you. So if you have any complaint about it, do let me know. You can also if you have too much discharge or pain when urine is coming out, do let us be aware so we'll know what to do concerning that. Then I'm going to document the procedure.
Yes.
And then noting the time, date, and then the size of the Foley's catheter that I use.
What else would you do?
Then I'm
You'll
going to
send-
take
Send the
sample for
sample,
urine,
yes,
MCS, for
culture and
urinalysis
sensitivity.
and
Yes,
culture and sensitivity.
yes, you have to send that. All right. Once you have introduced the catheter and imagine there's no urine which comes out after catheterization, what would you do? Or
Yes.
what you would have done?
Okay. If there is no, I'm going to put a little pressure in the suprapubic region to try to let urine to flow out through the catheter. Urine still going to aspirate the through the catheter, and then urine is then come out. I'm going to flush the catheter using a 50 ml syringe to hopefully, if there's any excess gel blocking the tube, it can flooding the catheter, it can be flushed out for urine to flow.
Okay. Just suppose you inserted the catheter and no urine came out. All of a sudden you realize patient has a suprapubic mass. What are the differential diagnoses you would consider?
Yes, a bladder tumor, then a pelvic kidney, then also I'll consider colonic tumor, or also yes, a colonic tumor.
Yeah, or large iliac aneurysm could
Okay.
also be there. Okay. Right. In this scenario, if as soon as you have inserted the catheter, patient reacts and goes into anaphylactic shock, what you would do?
Okay, I'm going to
Because of the
remove the
rubber.
catheter and then
Yeah,
start
immediately.
resuscitating the patients using the CRIPS protocol, and also called for
Okay, which injection would you give anaphylactic?
yes, I'll give the patient an IV adrenaline, and then also IV adrenaline, and also get hydrocortisone also
Yes.
for him.
What else would you do?
Then I'll give oxygen, ensure that he's breathing, and then secure IV access and pass, give him IV fluid to ensure that there is no cardiovascular collapse.
Okay.
Then if he's not, and then I'll also have to admit him for close monitoring.
Yes. What kind of allergy is, or what kind of allergy or reaction that is? Hypersensitivity reaction.
Hypersensitivity reaction, the type 1.
Type 4. 1.
1.
Okay. What includes in type 4?
Type 4 is a delay hypersensitivity reaction.
Okay. For example, can you give an
And
example?
it's seen in during Mantoux test.
Okay, can you, that is for tuberculosis. Simple answer. Okay, how have you determined which French catheter you would use? What is the normal range of catheter for an adult patient?
Yes, for an adult patient, I can use from 16 to 20, 16, 18, 20. It also depends on what I want to drain.
14 to, yeah, because
if I'm
depends upon
draining
the size of the
size,
patient.
yes, if I'm draining blood, patient is having a hematuria that I expect clot, then I want to use a larger size catheter so that it can easily evacuate the blood clot.
How should the patient be placed before doing this procedure? What should be the adequate or appropriate position of the patient?
Patient is going to lie supine.
Yes.
Then is going to the legs. Yes.
Right. Good. Thank you. Thank you.